University Hospital is the Canadian test site for groundbreaking technology in cardiac care. It's a machine designed to minimize the risk of stroke during heart surgery. Jan Sims has more.
It's a small machine that could have a big impact on preventing complications during cardiac surgery.
This is really a very remarkable breakthrough, a new introduction of very sophisticated technology.
Dr. John Merkin has been testing the device called the Sirox. It monitors blood flow in the brain during surgery using more than conventional infrared technology.
What this device has done is taken those same near-infrared light and now added an ultrasound wave. So we're using a very high-frequency sound waves that will also penetrate the skull.
The device is used for people who are at higher risk for stroke.
There are some patients, and it's difficult to identify them ahead of time, in whom their blood flow to the brain doesn't auto-regulate normally, and these are patients who would otherwise potentially be at increased risk.
Sensors are placed on the patient's head.
There's the ultrasound device that's transmitting the sound waves into the brain tissue, and then there's a laser light that's both shining into the tissue and then bouncing back and being picked up and analyzed.
Blood flow is monitored on the screen.
This is the type of thing that we see in the patients. So we measure the brain saturation on the two parts of the brain, and at the same time we can measure the blood flow on a continuous basis.
University Hospital is the first place in Canada to test the device. The tests have been underway for about 2.5 years now, involving some 86 patients.
If we can reliably demonstrate that we are measuring brain blood flow continuously and non-invasively in a variety of patients, it will not just be for cardiac surgery, but we can see it being widely applied to any patients in whom the brain is at risk.
Jan Sims, CTV News.